What has it been like to organize this vaccine clinic today, and what went into ensuring that everything goes right, or at least most things go right?
So we've been doing this since December 15th, and the preparation work has been a team event. My background is disaster management and emergency medicine. I'm a nurse by trade, so uh, we've been actually planning this since 1995 when biological terrorism was a threat to us back in the 90s. So we've been practicing this ever since. The only thing we didn't really practice was how to do 2 doses and bring people back for a second time. So that was a challenge for us. But a lot of hard work, a lot of hard energy went into getting this type of planning. A lot of people, as you can see, that are coming through, and a lot of people that we use to work this clinic. So it's been very rewarding work.
What does it feel to know that there's another vaccine that could potentially be making its way into arms of Lucas County residents?
So the other vaccine you're probably referring to is the Johnson & Johnson, which is a one-time dose. And so that's kind of exciting for us from the perspective of we can get it into more arms. It's a more stable product, so it doesn't require as difficult time of keeping it frozen like the other products that we have. So the likelihood of us being able to distribute that to more people, you can probably do that in physician offices, so that can become more of a normal type of a practice versus the current Pfizer product and the Moderna product where you have to do the 2 doses and the way you store the product.
Have you noticed any hesitancy among people to get the vaccine?
A lot of hesitancy, even in the healthcare environment. People are a little reluctant to get the vaccine. We're seeing that in the community as well. We're seeing that with the people that show up here that are very nervous. But I was one of the first ones in Lucas County to get the product. I feel it's safe, and it's definitely going to help us turn the tide against the COVID vaccine or the COVID virus right now.
What has collaboration had to do with this process? Because Mercy Health, the health department, everyone is collaborating to get this vaccine out. So what has that process been like?
So it's a great process. When you try to do it on your own, when each hospital was trying to set up its own pod, you're starting off with 100 doses, you're starting off with 300 doses. You're using a lot of resources for little return on your investment. Mercy Health worked closely with the Lucas County Health Department to come here to see what you see today. Because when you combine your resources, we're doing 3,000 to 5,000 people in one day versus and using each other's resources to do that. So we can do it in one day, get as many people as vaccinated as we can versus dedicating a whole day just to do 300 people. So that collaboration, we need more of it within the healthcare community where we do a bigger type of a pod to get more people vaccinated at once.
How long do you expect it will take for most Lucas County residents to get the vaccine? And do you think the consequences of that will be a great summer? So how long do you think that will take, and should we expect a normal summer?
Oh, those are, I'd like to get back to my job. And so since December, we've been asking that question is how long do we think this is really going to take us to reach our herd immunity effect where you want to get to 80%. Right now, like I said, when we're starting only doing 300 people in a pod, that's going to take us a while to get to the achieved numbers. That's where we need product from Pfizer and Moderna and the Johnson & Johnsons to get us the product so we can get these mass vaccination stations opened up. You'll probably see it come through FEMA, where we'll start using bigger centers to do more people at once. To give you a time frame, I can't even give you a time frame. I'm hoping by summer, but that's just a guess at this point in time.
Who is top priority to receive the vaccine at this point in time?
So top priority is determined by the Ohio Department of Health and the governor's office. So they started with healthcare providers that were taking direct care of COVID patients, and then they moved towards the 1B population, which we started with patients that were in nursing homes, long-term care facilities. Then we moved to people that were 80 plus, and then we're starting to every week move down the chain. So we're doing 80 plus down to 75 plus. Currently we're at the 65 plus age bracket at this point in the game. And then I think it was probably 2 weeks ago, we started doing the Lucas County teachers. We did them at the University of Toledo, and we did 4,000 the first day and 4,700 the second day. And that was the next group that we were doing. So they did, the governor's office and ODH determined who we need to vaccinate.
What are some challenges to getting this vaccine out to all those that are eligible?
The challenge is really you got to register by computer. So if people don't have access to a computer, you can call 211 and they can help you get your appointment. But it's just a matter of finding a site, finding an available time. When you look on the website, you see multiple areas where you can get vaccinated, but when you click on them, they may not have any times simply because they only have 100 doses or 100 appointments. When you look at a site like ours here at the rec center, you got a little bit more time to sign up because we got 4,000 appointments ready to go, and those will fill up in like 4 days. So it's a matter of access to the internet, calling 211, and just finding an available time and site.
Do you see that in the near future, at some point in time, that people will be receiving the flu vaccine and the COVID-19 vaccine simultaneously?
Well, yes, it's going to happen. We get new employees coming into the hospital. So a challenge for us right now is when we get a new employee, we got to get them all their vaccines. So not only the flu vaccine, but we got to make sure they have the hepatitis vaccine. We got to make sure we start factoring in how we're going to get them the COVID vaccine. And so that's one of our challenges of determining, when we get a new employee into the hospital, how are we going to get them vaccinated and what sequence. We also have employees in the hospital that didn't get their first dose back in December and January, and so we're trying to make arrangements for them to get their doses at this point in the game.
Is there anything else you'd like to add?
I tell you what, I know our nurses that have worked these clinics have been tearful because this is rewarding work. Seeing the heartfelt people coming into these clinics that have been quarantining themselves in their house since last March, they have not been out of their house. And so bringing them out here is bringing them hope, and that's what we're doing, is we're injecting hope into our community to get back to being a community again.